And like I said, in this handout, your immunology packet, you want to turn to the hand hygiene packet. Now, everybody and their mother-in-law knows what the hell to do with hand hygiene. But there was a couple terms, I think, in UWorld that you might have been like, huh? And so what I want you to do is I want you to write ABHR, all caps. ABHR. So that stands for alcohol-based hand hygiene. And what can you not use this with? C. diff and what else? What else can you not use alcohol-based hand rub with?
Marissa?
Huh?
Marissa?
Marissa and VRE, you have to be careful, okay? But for sure, C. diff, and for sure, like your test may say, grossly dirty hands, right? You just want soap and water for that. Okay, so that's important. And then at the bottom, you see it says use the soap and water. And I want to give you something that's a little confusing if you don't know what's going on. The title of this page says hand hygiene, but on the bottom, I want you to put something that's a little different. Put pulmonary hygiene. Raise your hand if you've heard of that term, pulmonary hygiene. Like, what in the world? Has anybody, raise your hand if you've heard of pulmonary toileting, respiratory hygiene, pulmonary toileting. I want you to write the pulmonary toileting down too. So you got respiratory or pulmonary hygiene, and you have pulmonary toileting. Your test may give you a select all in that. And let me tell you what it involves. Suction, cough and deep breathe, incentive spirometry, cough etiquette. How should we cough? In the inner sleeve of your shirt or blouse, or into your elbow. And then don't forget using a surgical mask. Part of pulmonary toileting or hygiene includes push fluids. So hydration. Okay, so you might see that term used. And it's for our respiratory patients, especially bronchitis, pneumonia, COPD, and cystic fibrosis. Okay, next page. Now, this page can be confusing. So, what I tell you about that page is you have two sides. One is the bottom one says medical asepsis. The other side of the page says surgical asepsis. Highlight those two terms. So highlight those two terms. They're very, very different. One of the ones I want you to highlight on the side of the medical asepsis is where it says clean technique. Everybody see that? Clean technique. Under the bottom of that same side, you see it talks about medications, enemas, tube feedings, daily hygiene. Make sure you know basically any GI procedure is going to be clean technique. The job I do is not going to be sterile. This is where we are disinfecting, and we're trying to reduce the number of disease-causing organisms. Reduce the number of disease-causing organisms. And another way to say that is killing the spores. S-P-O-R-E-S, killing spores. Now, on the right-hand side, this is your surgical asepsis or sterile technique. Here you want to make sure you know sterilization means killing all organisms or microbes. Killing all living organisms or microbes. You're not just trying to reduce the number, you're trying to kill all living microbes or organisms. Now, pay attention to that side, because you can see on this side of the paper, you're talking about tracheal and nasopharyngeal suctioning, catheterizations, surgical procedures. I actually want you to make sure you put dressing changes on here. Dressing changes. Now, at the top of the page, on either side, it doesn't matter where you write it, we're going to do some quickies, right? So here we go. Which hand should you put your glove on first? Remember what I said. Which hand should you put your glove on first? And remember, there's going to be 2 words on the test. Non-dominant and dominant. Which hand do you want to put the glove on first, sweetie? Dominant? Dominant? What's Nakia in the back?
Non-dominant.
Non-dominant?
Dominant.
Dominant? Dominant. You got to put the glove on the dominant hand first, because you're trying to get the most control over the sterile field. And if you put the sterile glove on the dominant hand first, in my case it's right-handed, you'll have really good control over not contaminating when you put the glove on the other hand and when you do anything else with that hand. It's better controlled. So that's on your test. Non-dominant hand. When drying your hands, should you do them in full extension or flexion? Nakia?
Wait, you said non-dominant or dominant?
Dominant hand. You put the glove on the dominant hand first. Okay, so how should you dry your hands? Should they be in full extension or full flexion? Nakia? Flexion, full flexion.
Flexion.
Full flexion.
I don't know what that looks like.
You don't need to know. It ain't gonna show you on the test either.
Flexion or what's that?
Or extension.
Flexion.
Extension.
Okay, so full flexion is this. Extension is this. So drawing your hands like this is full extension. Drawing your hands like this is full flexion. Look at your picture. What do you think it is? Yeah, because here's what you need to do. Look at the picture with his hands up. Let that guide you on this answer. Pictures speak 1,000 words. And earlier on the pre-op packet, I had another picture in there with his hands like this. let that guide you and say to yourself, oh yeah, because you're not allowed to let your hands drop below your waist. That's the key. So we keep our hands up like this and we draw down, okay? Full flexion. Make sure you write it on his face or his arms, or put full and then flexion on the other glove. I don't know. So this is what full flexion looks like. Okay, now, let's see what else we got. All right, you are pouring sterile fluids. And anybody got a bottle? Yeah, this will be good. So this is your sterile solution. Okay, all good? Should you pour sterile solutions by, should you pour sterile solutions before or after you don your sterile gloves? Before or after?
Before. Oh, before.
Okay, so remember when you pour sterile solutions, the solution is sterile, the container is not. So therefore, you need to pour before. Let it rhyme for you on the test. Pour before. Okay? So pour before sterile gloves. Because the container is not sterile, the solution inside is. All right, so that's one. Let's do another one. You are pouring betadine. Should you pour the betadine with the label in your hand or outside of your hand? Should you pour the betadine with the label of the bottle in the hand or not in your hand? Micaiah?
Inside. Yeah.
Got it. Inside.
Not inside.
No.
Okay, so watch this. When you pour your solutions, you should grab the label in your hand and pour. Now watch this. When you do that and you lift up, betadine, which is very staining, can drip down the side, but not on your label. Okay? So this is another good one for you. Pour the label in your hand so that you pour the solution away from the label and don't obscure some instructions you might need if you get a splash that you didn't want. I would say those 3 questions will mix you up big time. People do not like those damn questions. Okay? Okay, let's see if there's anything else. Okay. This was completely closed and sterile fluid. Once you, no, not sterile. Sorry, guys. Completely closed, never opened before ever. And it's just regular solution. Let's say normal saline. This is normal saline. Once you open it, how long is it good for? It's not sterile. So we're not anticipating to call it sterile. But once you open it, how long is it good for? 12 hours? 24?
24.
24?
Couple seconds.
Couple seconds.
You finish what you're doing?
So it's only one-time use. So it's not good at all after you open it. So you use it and you got to ditch whatever's left. And we have a hard time with that on our unit because that's a lot of, we feel like we're wasting a lot, right? It's almost like I wish I could use a smaller container because you don't, it's a lot of fluid. It's America, it's typical. Because everybody else and their mama-in-law would say that shit. But here we are in the US of A putting tariffs on everything, but we throwing away shit. Okay, so once you open it, it's no longer considered okay after that patient's use. Remember, one-time use only per patient. Okay, so that's another one you gotta know. All right, I think I got you good there.